My name is Jay Dewey. I am the Associate VP of Marketing and Development for Hudson Valley Community Services and Cornerstone Family Healthcare. And I'm here with Ryan Schoenau, who is our Hep C Patient Navigator. But he is going to introduce himself and tell you more about what he does here at HVCS.
Hey guys, my name is Ryan Schoenau. So basically, I'm the Hep C Patient Navigator for Hudson Valley Community Services, Division of Cornerstone Family Healthcare. My job requires a lot of different things. I do not only outreach and education to people that need it, but I also link people who test positive and reactive for Hep C. So not only do we do the linkage to care, but we also do testing here. And all these services are free. So that's a little bit about what I do.
All right, so we are recording this video because May is Hepatitis Awareness Month. And so you may have already kind of touched on this in that little intro, but what are the goals of the Hep C Patient Navigation Program?
So our goals is not only to educate people about hepatitis C and bring awareness to it, because there's still a lot of misinformation out there and old news that still gets passed around a lot. But besides that educational piece, it's really linking people who test positive to care and keeping them engaged in their care and bringing them all the way through, so that way we could get them the cure and get them the help that they need.
What are the very basics about Hep C that everyone should know?
Well, everybody should know, first and foremost, that hepatitis stands for hepa is Latin for the liver, and titis is an inflammation of. So I'm sure you've heard of other things that end in titis, that just means an inflammation. And hepa, that's your liver. So basically what hepatitis C is it's an inflammation of your liver. And a lot of people, they think, oh, that can't be that bad. When you really think about the functioning of the liver and what it does for your body as a whole, it's really important to address this concern because a lot of the times, Jay, when you finally are able to feel the hepatitis and it's taking a toll on your body, you're in really the late stages. You're in that cirrhosis, that liver failure. And that's why you're really feeling the effects of the hepatitis. Because fun fact, hepatitis, the liver actually doesn't have any nerve endings in it. So you don't feel the hepatitis. You don't feel your liver getting all scarred up and all, worn out and, where you could go to the gym and work out and, really beat yourself up and you feel that right then and there and it hurts. You're not going to feel that with hepatitis until 10, 15, 20 years down the line. Jay, that's why they call it the silent killer. Because the thing about hepatitis is by the time that, you really start feeling it, a lot of the times you're really late in the game. And it's going to be really hard to bounce back from that. Because another fun fact, the liver is actually the largest organ that you have inside of your body. And it also is one of our only organs that is able to regenerate itself. So that's why I always tell clients, the sooner we catch this and the sooner we address it, the better shape your liver is going to be in the long run. So that's why it's so important to know your status.
Right. That was excellent. Could you briefly tell us about as far as I know, the three different types of hepatitis, A, B, and C?
Yes, so there's hepatitis A, B, and C. These are all viral hepatitises, but I'd also like to touch on a moment. You could have hepatitis that isn't caused by a virus. That's why we see when people are heavy alcoholics, we see the same cirrhosis, fibrosis, liver failure that we see in people with hepatitis. So there's a lot of different ways, over medicating with certain medications. If you're overdosing on those medications, your liver's working overtime to try and get them out of your body, so it's inflamed. Same thing with drinking too much alcohol, it becomes inflamed, and other environmental factors could also lead to this inflammation of the liver. But the three types that you said, those are all viral types. So I'm sure we all know what viruses are here in 2021, my apologies. But basically hepatitis A, B, and C are different forms of this inflammatory viral infection that goes on in the liver. Hepatitis A and B both have vaccines to them. So, a lot of people, especially nowadays, kids growing up, hepatitis A and B are most required by a lot of public school systems. So a lot of people already have their vaccines for these. Hepatitis A is really seen when we have fecal matter, when the fecal matter becomes ingested or finds a way into our body. So that's one of the biggest things with safer sex practices, using dental dams if, you're going to go down that route, or, making sure that you wash toys before putting them in other places, things like that. We really want to be careful of, cross contamination. If something goes up the rectum, it should really get washed before it goes into another area of the body. So, that's a really big thing. That's really how people get hepatitis A, is through the fecal matter. But, Hep A is one of those things where you could take some medication and you could clear it and everything will be good. Hepatitis B is another one. We see that a lot in food service, where blood might be transferred through, cuts, things like that. But, there's also a vaccine for that as well. So those are the good news about hepatitis A and B is you could get vaccinated and, you could have a little bit of protection. Whereas hepatitis C, we have no vaccine. So that's the biggest thing really, is we have no way to protect ourselves. So we need to be extra vigilant, and we need to, really do our homework and really, follow all the steps and make sure that if we're an intravenous drug user, that we're using clean needles. If we're around blood, that, we're using safe PPE and we're being safe, and getting tested regularly. Is one of the biggest things, because if you could catch that early on, you don't have to go through those later stages of cirrhosis and fibrosis and liver failure. My apologies, it's fibrosis, cirrhosis, then liver failure. But testing is really the biggest thing. Now the CDC actually recommends that everyone be tested for hepatitis C, just because it's good to know your status, and there's a lot of varying ways that you can get it.
But the good news related to Hep C is there is now a cure within the past few years. I assume I've got that right, but let me know if I got that wrong in any way.
Yeah, so we do actually have a cure for Hep C now, and that's one of the biggest reasons why I always tell people to get tested, because, if you get tested and worse comes to worse, you wind up having the virus, it's good to know, because then we can start to address that with your care provider and your physician. Whereas the cure now is a lot less intensive, a lot less side effects, a lot less harsh on the body than the older cure was. So, just to go into that a little bit more, Jay, before we had these new medications, these targeted antivirals, we were kind of just carpet bombing the system, much in the way that, we would do with HIV/AIDS infections, where it'd be, some heavy interferon, it would be, just a bunch of antivirals, it would be, the shots, the pills, all this stuff. It made people feel suicidal, sick, just really terrible all around. I've talked to some clients that they had taken that and they said they hated it. It was terrible. One of my clients even said it didn't cure him. So, he went through this 8-month treatment of living hell and no cure. And that's tough for a lot of people. And that's one of the biggest reasons why I say education is so important, because you'd be surprised at how many people still have that old mentality, that old mindset of, oh yeah, I know somebody that went through the treatment and they weren't even cured. And they said it was terrible. They said it was, one of the worst things of their life. And that's what really keeps a lot of people hesitant in regards to their care, because they have these old thoughts in their head, these old ideas, this old news. And they say, I don't want to go through that because my hepatitis isn't giving me a problem, because they can't feel it giving them a problem because there's no nerve endings there. So how do they know, really? It's not like they're going out, they're getting their bloods, they're getting all these things checked constantly, and they know. A lot of the times, these are people that are, heavy into their addictions, and they're dealing with that on the day-to-day basis. The hepatitis is the last thing on their minds. They got to worry about where they're going to sleep, how they're going to eat, how they're going to get their next fix so they're not sick. And really, in their mind, yeah, I could deal with my hepatitis, but do I want to be even sicker than I already am with my addiction? And a lot of people say no, and they don't want to. So I think that's one of the biggest things is putting out the education that it's not that medication anymore. Nowadays, we have more targeted antivirals. A lot of the ones that we see prescribed is either the Harvoni or the Mavorite. And this is a combination medication. I'm not going to try and butcher the names of those medications because they never work. But really, really great medications. These medications have upwards of 90 to 95% cure rates. And they're also very much less hard on the body. And there's no shots either. So it's either, one pill, 3 pills a day in the morning, 1 pill or 3 pills a day in the morning. And as opposed to where the old treatment used to be 8 months, this treatment is only, 8 to 12 weeks at most. A lot of people are on the 8-week regimen. That's what I see prescribed most. And, it's an easy couple pills in the morning, if that, if not maybe one big horse pill. But it's only 8 weeks, and the cure rate is so much higher, where a lot of that percentage that don't get cured, the reason we really see that is because they fall off their medication. Or if you look at their medication card, it looks like a bingo card, because it's like, I got this day here and this day here and this day here. So just like we see, with PrEP, where they say it's 99.9% effective, and that 1% is really human error. A lot is, the same that we're seeing with this hepatitis medication is, a lot of that percentage that might not get cured, it's coming more from human error than, the medication actually not working. That's not to say that, some people might have adverse reactions and might not take to the medication well and get cured. But statistically, you have a really good odd to get cured, So
Yeah, it comes down to the adherence issue. Once again, just like with your HIV meds, PrEP, like you said. Yeah. So who is it most at risk for Hep C?
So the people most at risk for Hep C, the biggest cohort that we're seeing is really intravenous drug users. But we're also seeing now, whereas it used to be baby boomers we wanted to see getting tested, we're now seeing the younger cohort, so ages, 18 to 25, and even 18 to 35, really. The younger generation, because we have this huge opioid epidemic going on right now. So it just compounds the amount of new cases. We're seeing more and more new cases with young people than ever before, with this opioid epidemic, because people are sharing needles, people are not using the most risk reductive means of getting high. And the other thing is, they're not really educated, whereas an older person might know a little bit about Hep C. It's not like they're teaching about Hep C in high school or in college. They're not saying, oh, you could catch this from using needles. I mean, the drug education alone in high school and beyond is really abstinence-based most of the time, and that's already proven that abstinence-based education doesn't work. Um, but besides people who are intravenous drug users, we also see people who have had blood transfusions, blood products, or organ donations before June of '92, because this is when more sensitive tests for HCV were introduced for blood screening. So before that, we didn't have as sensitive of tests. Sometimes, infected bloods or infected organs would make it through, and find their way into a healthy person, and then lo and behold, now they have Hep C as well. Also, healthcare workers who suffer needle stick injuries, um, infants that are born to HCV infected mothers, people with high risk sexual behavior. These are more slightly increased risk for Hep C. So we see a lot people with multiple partners or already have sexually transmitted diseases, or also a lot of people who have anal sex. Because the thing is, anal sex, the anal glands don't produce as much or if any lubrication, and a lot of people don't use enough lubrication for anal sex. So we see a lot of micro tears in the anus, and micro tears lead to blood, and blood leads to hepatitis C if you're infected. So if you have Hep C and you're having anal with someone, and they tear up your butt a little bit, there's a possibility that you might have Hep C. That you might get it from them. Um, Also, people who snort cocaine or use shared equipment. I've also been telling people that smoke crack, because when you're smoking your stem, the stem gets really hot and it'll burn your lips. And then if you're passing that to your friend and they're getting it really hot, they're burning their lips and opening up their lips, and you're going back and forth with dirty burnt lips. There could be microscopic blood on that as well. Also, people who have shared toothbrushes, razors, or other personal items that with a family member that was infected with HCV. Like I said, a lot of people don't know that they're infected with HCV because it's a silent killer. So you might not know, and you might go to just grab a family member's razor to get a quick shave in before work in the morning, and if they had used it recently, there could be a small chance that you can also contract HCV. Because not a lot of people know this, but hepatitis could actually live up to 2 to 3 weeks outside of the body. So that's one of the biggest things why we tell people, injection drug users, not to share waters, not to share ties, not to share cookers. Keep your kit your kit. Um, we have syringe exchange programs that give out clean needles. We have syringe exchange programs that give out, clean, fresh kits. They have all the supplies you would need. And normally, I sit on those vans. We pack those safer injection kits. I'll always make sure to throw in some extra caps, some extra waters, extra things, because, don't use other people's stuff. And if you have extra stuff, clean stuff, make sure that if somebody that you're using with doesn't have clean things, don't let them use your dirty one. Let them use a clean one, which is really the biggest thing. And that's really how we're going to combat this. Because like I said, we're just seeing the numbers skyrocket in the younger generation. So we really need to be vigilant about this and educate, because otherwise we're just going to see it continue on the path that it is.
And that's exactly why we have a Hepatitis Awareness Month. So that's great. Yeah, I did not know that it could live that long outside the body. So glad to learn something new. Yeah. How can our viewers contact you to find out more about the program and about Hep C?
So any of our viewers could call me directly or text me. My number is 845-704-7752. Again, that is 845-704-7752. And I'd be more than happy to talk about, hepatitis, what treatment looks like, what care looks like, what you can expect. If you want to get tested, let me know. We'll set something up and get you tested. And if you need to know about things like our needle exchange, things like that, give me a call. and I'll link you to those services as well, so we can make sure that you're well taken care of and that you have, all the supplies that you need to use safer, because there's no safe use at the end of the day. There's only safer use. And if we could at least bring it a little bit safer, that's a huge thing, because at the end of the day, people are going to do what they want. People are going to use drugs, whether they have clean needles or not. You hear horror stories sometimes. I've been told by a client, back in the day before we had these needle exchanges, they used to sharpen their pins, their needles, so they could stick them, because they'd become so blunted after so many uses, that they would have to, figure a way to get them sharp again. So we definitely have come a long way in our legislation and in the services that we provide, but we still have a lot further to go, and we still have a lot more stigma to address and break down.
Right. I shall remind viewers that all our services are free, and hopefully they can also tell that there is no judgment here. It's a judgment-free zone. We let people do and be who they want to be and do what they want to do. And we just help them, as you said, do things safer, hopefully.
Yeah, definitely. It definitely is a judgment-free zone. Nobody's going to judge you. We have a lot of people that are in recovery themselves. I personally am in recovery as well. So, I'm a great person to talk to about that kind of stuff. I won't judge anyone for anything. I've been there, done that, seen it all, really. So, if you got a problem and you need somebody to talk to, give me a ring. If you want to get tested, give me a ring. Whatever you need, we're here to help at the end of the day. And in any way that we can, we're going to do it. I always tell people, if I can't do it, I know somebody that can. And if I don't know somebody, I know somebody that knows somebody. So, whether it's you want to get into treatment, or you just want some cleaner and safer injection supplies, or you want to get tested for, HCV, HIV, STIs, whatever it is, give us a call, and we'll make it happen to the best of our abilities.
Excellent. Ryan, this was excellent info. Thank you so much for doing this and what you do every day. I will make sure that your contact number is up on the screen, and they can also go to the HCV page on our website, hudsonvalleycs.org. Yes, May is Hepatitis Awareness Month. If you need any assistance with anything, just contact us either at Savimar, go to our website, send us an email, whatever you need to do, just get in touch and we can definitely help you out. So Ryan, thank you so much for all of your knowledge and the easy way that you talk about it and break it down for people. Just thank you.
Thanks for having me, Jay. It was wonderful to be able to do this and really get the information out there, because like I said, there's a lot of misinformation. There's a lot of old information. So it's really out with the old, in with the new, and just in time for spring too, right?
Right. All right. Well said. Thank you again so much.